Hi, my name is Dr. Mark Smith. Welcome to Progressive Chiropractic. A healthy spine means a healthier you. When a patient comes into the office for a regular visit, what we're going to do is use this instrument here. It's called an infrared thermal scanner. And what it does is it measures heat temperature of the back. See here, this is an example of a person who has a really cold spot up in the neck when they started. That indicates that there's a long-standing problem in there. And over time, as we worked on this individual, they got better and better, improved more and more, until we got them to this point where they've got a real good-looking kind of straight scan here compared to where they started up here. Okay, so this is a really great tool to use because it gives people a bit of a different experience. For patients that are really in a lot of pain and having a lot of issues with mobility, what this bed actually does is comes right up to 90 degrees so that a patient can just stand right on the platform right here. We can adjust the table to their height, just like so, for a taller individual or for a shorter. The patient is just laying face down, and we just bring them down very nice and gently. So if I need to work on their pelvis, for example, I set the weight of the table to the right weight, and then I just push, and the table cushions the adjustment. And then the headpiece can rotate in all directions to help facilitate the adjustment. Again, it's not the twisting type of adjustment that is commonly used with chiropractic. It's just a push down like that. The table absorbs the push. What I also use is this instrument right here. It's called a variable frequency electronic adjuster. And so what I can do is actually set the force on the instrument right here, and then this just puts a tapping force into the spine like this, just to move a bone back into position. And also to work on soft tissue like muscles to get rid of trigger points, for example. And so it's very useful for a lot of applications. Well, this technology right here really sets us apart. What this is called a video x-ray machine or video fluoroscopy machine. And what this allows us to do is put the patient, set the patient up and have them go through a range of motion with their back so that we can actually see the spine in motion and really identify very clearly where any spinal issues are. And so, for example, I'll have them sit, take their head through a range of motion back and forth, side to side, and see which vertebrae are moving, which ones aren't. We then capture the image, and then we send it back to the computer here. After a person's gotten a video scan, what I do is actually take them through and show them exactly what's going on with their neck. So what we're looking for example, in the neck, is that when the patient bends forward, we're looking for everything to separate real nice and smoothly, and right away I can identify exactly where the issue is, kind of right in the middle of this person's neck. Pain could be coming from right up top in the neck here, but the issue is coming from down in the middle. And so it really takes a lot of the guesswork out of analysis and really helps define the problem very easily. And the nice thing is the patient can see that for themselves as well. So we do this for the neck, kind of the lower part of the neck, the low back, and really identify the problem clearly. Absolutely. My approach is called the Pierce Results System of Spinal Correction. And a very small fraction of chiropractors use it, and it's actually more prevalent on the eastern side of the U.S. In the east. Bringing this back to Victoria is I'm bringing kind of a new perspective, a fresh approach to chiropractic to the city.